Okay. So today is the first lecture of, I'm not sure how many lectures we've got, 3 or 4 of gynecology. Okay. So we'll start off with the physiology, then we'll have the pathology, the etiology, some diagnosis, not the whole thing. I will concentrate mostly on tongue diagnosis, and then treatment of specific problems. And I think Dr. Wang will do some of it. So I'll be sharing it with Dr. Wang. So let's start from the beginning. Obviously, some of this material is already in my gynecology book, but some of it is not. The gynecology book is now 11 years old. So some of the material that I'm presenting is not in that book. In fact, I'm rewriting. I'm writing a second edition of that book. It's very frustrating writing because 6 months after the book comes out, I already want to change it. I see lots of things I want to change. So let's start by talking about the women's physiology and particularly 5 headings. You might have 4 in your handout, I'm not sure, because I've added one in the first one. You don't have these headings at all. So we'll discuss the uterus in Chinese medicine, the nature and origin of Tiangui, the 4 phases, which is absolutely crucial. This is the most important thing in gynecology. I cannot stress how important it is in treatment, the 4 phases. More and more and more I see the importance of them, especially to treat infertility, also menorrhagia, and the 2 very common diseases, endometriosis and polycystic ovary. Then we'll talk about how the Zhang Fu influence menstruation and the extrameridians. All of that from the point of view of physiology, but obviously by talking about physiology, we'll frequently in the lectures slip in things about pathology and treatment. So let's start by talking about the uterus. The uterus is called zebao, and ze means baby. And bao gives the idea of a container. Bao. You got the character there in your handout on the first page. And as you know now, you probably know now how many components to that character.
Well, it depends on the first one.
It depends on what.
Well, we were taught that the first part of it could be 1 or 2.
Yeah, exactly. Yes.
Yes. It could be 3 or 2.
Yeah, but in this case.
Oh, on that one?
In this one.
Sorry.
In this one. How many parts to that character?
2, 3, 4, 5, 6.
No, not strokes.
Oh.
How many components?
2.
2.
2 sides.
And the one on the left indicates what?
Moon. The moon.
No.
Or flesh.
Flesh. The moon is different. It's flesh. So anything with that, that's the radical on the left. Tells you it's something to do with the body, anatomy, physiology. The Zhang Fu have that. Okay? And the one on the right is phonetic, but it also gives the idea of a container.
Why does the heart have that?
Sorry?
It seems like all of the organs have that radical except for heart.
Sheen, that's true, because the character for heart is very pictorial. The character for heart is that, and it's really the heart with the arteries coming out of it. It's very pictorial, very close. Originally, all the characters were pictographs. The character for horse, my name was a horse, this one. And then gradually, over the centuries, they became more and more stylized. But in the case of the heart, the actual character of the heart is very close to its pictograph. Okay, the important thing to clarify about the bowel is that men have it too. And this diagram here makes it very clear. So it is wrong to say that the pao is the uterus. It's not. The pao is the uterus. But pao is not the uterus because men have it too. So the pao in women is the uterus, and what is it in men? It's not clear. It's the room of Jing. And you can translate Jing as Jing or sperm. It's up to your choice. It's the room. So in the dantian, in the lower dantian, women have the uterus, which stores blood. Men, the lower dantian in men, is, so to speak, is empty. Because the room of Jing or room of sperm, whatever you call it, is not a physical structure in the same way that the uterus is. Is that clear? And this alone, this diagram alone, illustrates a fundamental clinical tip in gynecology. That because of this, because women in the lower dantian have the uterus which stores blood, they're very prone to blood stasis in the lower dantian. Far more than men. Far more. And another clinical tip is, I would say, I would go so far as saying, in chronic, complicated gynecological conditions, always suspect blood stasis, even if it's not that obvious. And when we talk about diagnosis, we will see how it's not always that obvious. Yeah, they say, if you read the books, they say in blood stasis the tongue is purple, but it's not true. Because you can have a blood stasis with a normal tongue. Okay? But that is my first advice. In chronic, complicated gynecological condition, always suspect there might be blood stasis. Check. Yes?
Would you consider this blood stasis to be physiological as well as pathological?
Oh, there's pathological.
Part of a female?
No, blood stasis is always pathological. Oh yeah, there's no such thing as physiological blood stasis. But they are very prone to that because the uterus stores blood. And the blood stasis, by the way, in women in the lower dantian can come from what? Chi stagnation is a common one. And another very common one is cold. These two are the two most common ones, especially in young women. In older women, then it gets more complicated. However, there is another very important thing to say about the uterus. When you talk about uterus in Chinese medicine, gynecology, it should be in quotation marks because, in my opinion, it must include the ovaries. The ovaries were not mentioned in Chinese gynecology. And if you look at some of the functions attributed to the uterus and to blood, it's obvious that they are functions of the ovaries. So we should assume that when you read the uterus in Chinese gynecology books, it should include the ovaries. And by extension, the tiangui, as we will see shortly, should include the ova from the ovaries. Okay? So this diagram here illustrates very clearly the principle that the bowel is common to both men and women, and that menstrual blood and sperm are a form of tiangui. We're going to discuss tiangui in detail in a moment. We'll discuss that in detail. So you could say that in women, the lower dantian is kind of full. In men, it is empty. And that, by the way, interestingly, many, many years ago, one of my Tai Chi teachers used to say that women should not meditate, concentrating on the lower dantian sitting down, because it may cause blood stasis. Men can. Sitting down cross-legged. And he said they should, either if they want to sit down cross-legged, they should meditate on the upper dantian, or if they concentrate their breath on the lower dantian, they should do it standing up like that. It's interesting. He said it leads to blood stasis. And this quotation from the Golden Mirror of Medicine, which is one of my favorite books, also because it's easier to read. It's interesting how some of these old books, they differ a lot in the style, and I find some very difficult to read, and some are relatively easy to read, and this is one that is relatively easy to read. And it clearly makes the point that the bowel is common to both men and women. In this particular quotation is in relation to the Dumé, and we will talk about the extrameridians later. Also called dantian in both men and women. In women it is the uterus, in men it is the room of sperm. I repeat, you could translate that as sperm or jing, room of jing. And the extrameridians arise from this area, from the dantian, where the bowel is. The uterus is one of the 6 extra fu. You remember the extra fu? They're called extra because they are kind of strange, because from some points of view they behave as a fu. What do the fu do? They filled and discharged. They are filled and emptied. And from other points of view, they behave like a tsang. What do the tsang do? The tsang store. So, as you can see in this diagram, the uterus could be considered a tsang because it stores the uterus, the blood in the uterus, or the fetus in pregnancy. From other points of view, it functions as a fu, discharging blood with menstruation and during labor. The discharging function. By the way, of the 6 extra fu, the uterus and the brain are the 2 most clinically relevant ones, much more than the other 4. And by the way, that character fu extra, fu is qi, the same qi, and it's in the qi jing pa mei, in the extra meridians. And that's not by chance, because the extra meridians are a way in which the 6 extra fu are coordinated with the tsang fu. For example, in the case of the uterus, we say the liver houses blood and influences the uterus. But how does it do that? Through the ren mei. Because the liver channel doesn't go through the uterus, but the ren mei does, and the chung mei does. So the extra meridians, in this particular example, ren and chung, are a way in which the extra fu are integrated with the tsang fu. And that qi is the same qi as in the extra meridians. And that qi, by the way, can be translated as strange, out of the ordinary, but also can be translated as surplus, adding something. And that's what the extra meridians do. They add something to the channel system. So very briefly, this is a brief introduction. We'll come back to all of these. The kidneys are the ones that have the strongest influence on the uterus. When I started studying, okay, so this is a summary of the 4 phases. Have you got this slide? Yes, you do. I can see it. We have discussed everything here. The Dr. Xia's prescriptions are in my gynecology book. That's the page 727. Let's look at the body temperature, which is interesting. The rise of temperature that occurs after ovulation reflects the increase in yang. That rise in temperature, by the way, is very, very small. It's only like 0.6 degrees. And the temperature should kind of rise and then stabilize like that. These are two examples of normal temperature charts. It's biphasic, two phases. There should be that lowering of the temperature there, and then rising of the temperature there, and then being more or less stable and going down gradually. And that's another normal one. Dr. Shah attaches great importance to asking women with infertility to take the chart, take their temperature. And I would strongly recommend it as well. It's a great way, or objective way, to monitor the treatment, see how the treatment is going. It encourages the patient, when you see a chart that is all over the place, and then after 3-6 months, it kind of looks more like that. It's great for the practitioner and for the patient as well. And it also gives you an idea how the treatment is going. And Dr. Shah has developed an amazing ability to, when I was with the clinic, in the clinic with him, he just looks at the woman's chart and it says, oh yeah, she's got blood stasis and cold in the uterus. He does a Chinese diagnosis on the basis of the chart, on that, through his experience. And this, I've given you examples from his clinic. Have you got this one? Yeah. An interesting one is that this seesaw effect that for him indicates heart fire and liver fire, when the temperature goes up and down there in phase 4, which is interesting. Another interesting one is here when the temperature is not rising, kidney Yang-Shu, and this is interesting in endometriosis. Often the temperature chart is flat. Interesting, Dr. Shah's explanation why it's flat. Here, in the first half, the temperature does not go down because there is blood stasis, which prevents the temperature from going down. In the second half, the temperature doesn't go up because there is kidney Yang-Shu. So in the result of these two is that it's flat, like that. So from the Chinese point of view, this rise in temperature reflects the minister fire, the rise of Yang, you remember in that curve. The only problem from our point of view in the timing of treatment is that the rise in temperature occurs after ovulation. So it's not much use to us. And that's where the cervical secretion is very important and very useful, because it occurs before ovulation. And we're going to look at that in a moment. So the cervical secretion occurs towards the end of the follicular phase. The glands near the cervix secrete a thin mucus, and that's directly under the influence of estrogen. And it's a mucus that should be kind of transparent and stretchy, like that. Like that. If you get it between your fingers and then you stretch, it kind of stretches like that. And Dr. Shah attaches great importance to it, and according to him, this cervical secretion is a manifestation of kidney Jing. If it's absent or too short lasting, we'll see in a moment how you define one that is too short. for him it indicates a kidney deficiency, even in the absence of any kidney symptom. So when the cervical secretion appears, then you know you're in phase 3. Phase 3 has started, and therefore if you're treating a woman for infertility, that's the time to give her the phase 3 formula that tonifies the kidneys, strengthens Chung and Ren, and there's herbs that stimulate ovulation, like 2/3. This is interesting that there is a relative dryness there after the period, which would confirm what we say in Chinese medicine, a relative blood and yin shu. Well, not blood and yin shu. Blood and yin are relatively empty compared to other times. And then again here, a decrease of mucus under the influence of progesterone and the yang, which dries up. So the red one is the transparent, slippery mucus like egg white, and also stretchy. And usually the temperature charts have a line for the mucus here. Let's say cervix. There is a line to indicate when the mucus appears. And as you know, the temperature is taken in bed in the morning before you get up. So that's the cervix. The cervix goes 2 stages. That's in phase 3, when it's open and there's the cervical secretion. And that's when it's closed. So everything we've discussed so far presumes that the periods are regular or mostly regular. What do we do when they are not 28 days or 32 days? You can still identify the phases in that the phases can stretch and contract. If your woman could have a cycle that is 25 days, in which case the phases are still there but they are contracted, or a cycle may last 34 days. In cases of polycystic ovary, the cycle may last 2 months or even 3 months. And you can still identify the phases, but it's difficult, and as Bob says, it involves a lot of phone calls. And these are the advice I give, which you have in your handout, or what to do when the periods are very irregular. And this is especially important for polycystic ovary. That's usually when they are irregular. Sometimes they come every 3 months. That's what you do. You wait for the period. When she's bleeding, she's obviously in phase 1. And after that, she's in phase 2. So the bleeding allows you to identify phase 1 definitely, and the beginning of phase 2. It doesn't tell you how long phase 2 is going to last. Then you check for the cervical secretion. When that appears, she's in phase 3, which is also confirmed by the temperature. When premenstrual symptoms appear, she's in phase 4. And each of these may last 4 weeks. Some women I've seen have premenstrual symptoms for 4 weeks. So phase 4 is 4 weeks long. And I would say this is particularly useful, 1, in polycystic ovary, 2, sometimes in bungalow. Sometimes in metrorrhagia, the situation can be very chaotic and may be difficult to distinguish the faces. Okay, so let's look. Any questions on the 4 phases? Let's look at the influence of the internal organs on the uterus and tiangui, starting from the kidneys. Yeah.
On page 19, it talks about period, like period 3 days, 35 days, 37 days.
Yes, yes.
We never really covered that, and I'm a little confused what that's talking about.
Yeah, that's, I think I need to change. That's not here. Yeah, let's look at that.
Reason that I'm interested. It's like a predictor of menopause?
Yeah, it's quite interesting theory. It's from Dr. Xia. That's from Jane Littleton's book. It's a great cartoon. To illustrate, Zhang Jingyue is the doctor I mentioned. You remember the doctor I mentioned? The doctor who formulated Yogui 1 and Zhuogui 1. He said that treating a woman equals treating 5 men. I.e., treating a woman is 5 times more difficult. Presumably the reason being that the gynecological system complicates the picture. And she's got lots of the very complicated mechanism. Expandable egg growing chamber, 40-week push muscle and chemical timer, 1 per month egg release chemical clock, etc., etc. Auto milk release sensor, etc., etc. And the man has only got 2 things: basic trigger and 40-year egg input and pleasure control unit. But I always show this cartoon. What? Some woman said, no, a man has only got 1 thing. Not even 2. But I always show this cartoon because I don't agree with the great Dr. Zhang Jingyue. Because I don't think that treating women is more difficult for these 4 reasons. One important reason is that the gynecological symptoms, in my opinion, help the diagnosis. And I'll give you an example. 2 patients, one is a man and one is a woman, have abdominal pain, and you're not sure whether it's cold, dampness, chest stagnation, blood stasis, just to mention 4. If the woman's periods are dark with clots, she's got blood stasis. So her gynecological symptoms help the diagnosis. They don't make the diagnosis more complex. Sometimes they do, but most of the times they are useful to help the diagnosis. And plus, women are easier to treat for other reasons. They're more in touch with their bodies, certainly more in touch with their emotions. You remember I told you a psychotherapist said that in his experience it takes 9 months for a man to reach a stage in psychotherapy where women start. And I'm not a psychotherapist, but I would probably agree with that.
Intuitively the case.
Maybe not in California, though.
It's 10 months in California.
What?
10 months in California.
And finally, very important, women are more open to change their diet, change their life habits, more flexible than men, generally speaking. Of course, all these are generalizations.
None of them have anything to do with us.
So are you suggesting by being an Oriental medicine you have a propensity for being more yin?
No, he's suggesting he's in denial.
I found personally treating women more easier than treating men for those 4 reasons, definitely, without any doubt. But, you know, my clinical experience is based mostly in England, so that's different. You know, English man. What?
Are they more Englishmen?
What?
about them?
What about them?
We don't really know many.
They are more repressed, yeah. Very much out of touch with their emotions, very much. With his
He seems to be.
How do you know so much about Beckham?
My husband likes soccer, so
Uh.
I watch football all the time. My husband's pretty in touch with his feminine side too.
Why are you blushing?
Why are you blushing? Okay, Dr. Shah has this interesting and weird theory about number patterns. He said that women gynecological constitution, remember we're talking about constitution here, that's an interesting part of this theory, is ruled by the number 3, 5, and 7. And what does that mean? That is based primarily on the duration of the period. If a woman's periods always last 3 days from the beginning, and she has no apparent pathology, her gynecological constitution is ruled by the number 3. Okay? If the periods last 5 days, she's ruled by the number 5. And if they last 7 days, she's ruled by the number 7. Why are the 3, 5, and 7 not 4, 6, and 8? Because women are yin, and they're ruled by yang numbers. He says, and it's interesting, and I think it is true, he says, if you ask a woman, how many days do your periods start? She may say 4. But he says, every little spotting counts. If your period lasts 4 days, but there is a spotting on the 5th day, that spotting counts. Your periods are 5 days, not 4. And he says, in his experience, is usually 3, 5, or 7. And this is the constitution of a woman. So, if her periods have always been 3 days, she is a constitution number 3 pattern. And her cervical secretion should be 3 days. So, a cervical secretion of 3 days in a number 3 pattern woman is normal. A cervical secretion of 3 days in a number 5 pattern woman is not. It's scanty. Or, if a number 5 pattern woman changes and their periods become heavier, 7 days, then she has deviated from her constitution and she has heavy periods. But if a woman has always had periods of 7 days, then they are not heavy periods. Do you know what I mean? It's a strange theory, but it's an interesting theory. And the other consequence of this theory is that the phases are multiple of 3. So the phases in a number 3 woman are shorter than a number 5 or 7. They're shorter. They are 3 or multiples of 3. And the phases can expand or contract. Phase 2 could be 3 days, it could be 6 days in a number 3 woman. And he says this also determines the onset of the menopause. In a number 5 woman, it will be a multiple of 5, i.e. either 50 or 55, not 49 or 53. Another interesting consequence of this, it is more difficult to treat a number 7 pattern woman than a number 5 or number 3. It will take longer. The tricky part of this theory is, where do you draw the line that something is constitutional or pathological? That's my question. If a woman's periods have always been 3 days, is that because she's constitutionally number pattern 3, or she has blood sugar?
I have a patient who has never had a period, never, but she has 3 children, and she came to see me before, she had already had her children, but she has no menstrual history at all, never had one period.
Well, I mean, that's very, very rare
Very
case,
unusual.
yeah.
And three
Three
healthy
children.
pregnancies, 3 children. I have no idea. I have no idea. But my assumption was, constitutionally, she doesn't have a cycle, but she's still I have no idea how that happens. I don't know.
No, I don't know. But from the Chinese point of view, would you say she had a pathology? From the Chinese point of view, like a kidney deficiency or blood sugar, or she did?
Well, she must have. I mean, she's not a big woman. She is.
But she conceived first time without any problems?
Yeah, no problem. No problem. I mean, I think, of course, she couldn't know when she was going to get pregnant. She had no map, no history, no cycle, but she just
long-distance runners.
decided,
No. Well, I mean, that's very rare.
Yeah. She presents like a deficient type person, but she has plenty of, energy. She's really more like I don't know, kind of.
Can you bring her in for show and tell?
Maybe, yeah.
I don't know how to explain that from the Chinese point of view.
I don't know either. I just assumed that she was a
And I've never seen that.
constitutional anomaly.
I have never seen that in my practice.
Yeah, no, I haven't either.
Another interesting application of this number theory pattern is how many days. When Dr. Xia is treating infertility and he gives herbs to stimulate ovulation, he does it for a very short time. 3 days in a number 3 woman, 5 days in a number 5, 7 days in a number 7. Okay, so it's a strange theory, but it's quite interesting. And it's certainly true that a number 7 pattern woman is more difficult to treat than a number 5 or number 3. Oh, he says that the number pattern also influences pregnancy and threatened miscarriage. I forgot that. He says the miscarriage will be more likely to occur at the time in pregnancy corresponding to a multiple of the number pattern. 30, 33, 36 for number 3 pattern, or 35, 40, 45 for number 5 pattern. I'd forgotten that. And another thing interesting is the prognosis and length of treatment. Let's say you're treating a relatively simple case of painful periods. number 7 pattern will take longer than a number 5 or number 3 pattern. Okay. So going back to this, the influence of the organs on the uterus and the tiangui, the kidneys are the main one because they are the origin of tiangui. The liver is not the origin of tiangui, although it plays an important role. It is not the origin. And the tide of yin and yang that we see in the menstrual cycle is the tide of kidney yin and kidney yang. Moreover, the kidneys play an important role because that's where the 3 extra meridians start. So it's doubly important. It's the source of tiangui. And also because the 3 extra meridians start from the space between the kidneys. And these 3 share a common pathway to Ren1. Then 1 becomes the Du, the Ren, and the Chung. Every book says a slightly different thing regarding the origin of the extra meridians. There are all kinds of versions. The Nanjing says that they start in between the kidneys where the Dung Qi throbs. The Dung Qi would be the Yuan Qi. The Dung Qi is a name that occurs only in the Nanjing. And it's basically the Yuan Qi. It says where it throbs. So that's what the Nanjing say. So other versions say they start from the kidneys. Other versions say they start in the uterus, but they don't say where they start in men. Others say they start in the Dantian, without specifying where. Others say they start below Ren 3. But generally speaking, it's in that area and in the area of the kidneys. The liver, of course, does have an important influence, mostly in moving qi and moving blood. And some of the Chu Mei functions are also liver blood functions in moving blood. The 2 are connected. And liver qi also plays an important role in phase 4. In moving qi in order to move blood. And as I had mentioned before, I had that diagram before, the liver is the overlap between the tiangui of the kidneys and the so-called normal blood, the blood that nourishes the eyes, the hair, and the hun. And that's why when a woman has menstrual irregularity, when deficiency of tiangui, she may have symptoms in the so-called normal blood area. And the connection between the 2 is from the liver. And with regard to the liver in gynecology, this diagram is very important because it's very common. Remember that liver qi relies also on liver blood. The 2 influence each other. And in women, very often we see a liver qi stagnation that is either deriving from or associated with blood sugar. And that's what the famous Gyao-san is for. Gyao-san is for this situation. Liver qi stagnation with liver blood deficiency. And when this happens, you may have contradictory symptoms and signs. Actually, not contradictory, but more complementary, actually. Like, she may have symptoms like that, indicating qi stagnation, but the pulse and tongue don't show it. The pulse is choppy and the tongue is pale. So the two are complementary. The symptoms are showing more that. Pulse and tongue are showing more that. Or frequently the pulse would be fine in general, but slightly wary on the left. And all these situations are the situations when you would use the famous Xiaoyao-san. Which in my opinion is overused, as I've said many times. The spleen influences menstruation in two ways. One, through qi. We already mentioned that. The sinking of spleen qi influences not only prolapse, which is not that common, but more commonly we see it in bleeding, excessive bleeding, in menorrhagia. So in menorrhagia, from whatever cause, qi is kind of sinking. So you want to lift spleen qi. Which I do in gynecology with 20 and Ren 4. And you could also add 6, Ren 4 and 6. That would be a great combination. Together with, afterwards, of course you can also do Ren 12 here. Bladder 20 afterwards on the back. Remember what I said earlier, that in menorrhagia is not only spleen qi that is sinking, but also kidney qi. And Ren 4 would do that anyway, would treat both. But the spleen influences menstruation in another way, in a secondary way, that although we've stressed a lot that Tiangui is not blood, it's water, but blood does play a role in it, a secondary role. So water is the origin of Tiangui, but blood, the postnatal blood of the spleen, does play a role in it. And that's why we often tonify the spleen to tonify blood. The heart influences menstruation in many ways. Let's see if there is a summary here. Yeah, there's a summary. Have you got the summary?
27.
You don't have the summary, but you have these slides, haven't you?
Yeah.
You have that and that?
Yeah.
Okay. Yeah, that's the summary. We've already discussed these things, the transformation from yang to yin and yin to yang, and discharge. You remember those two key words, transformation and discharge. And number 3 derives specifically from Fu Qingzhu. We have mentioned these 3. Number 4 is connected to the uterus through the Bao Mei, which I personally think is through the Chung Mei. And 5, heart blood. The heart governs blood, and it has a similar influence on menstruation as liver blood. So heart blood Shu can give you scanty periods. Heart blood heat can give you heavy periods. Heart blood stasis can give you painful periods. Gui Pitang, apart from anything else, apart from Gui Pitang, apart from being a great mental emotional formula, is also a gynecological formula. It nourishes blood and stops bleeding from Shu conditions. Okay, so a very big influence on the menstrual cycle, which is not often recognized. Of the 5 songs, the lungs are probably the one that have the least influence on menstruation, except occasionally I have seen situations of clearly sadness and grief affecting the lungs, a lung qi deficiency leading to blood deficiency. But out of the 5 songs, I would say the lungs are the one that affect the menstruation the least. And finally, the stomach has an interesting connection with the uterus. We already mentioned that before. It's through the Chung Mei, because the Chung Mei has 2 major functions. It's sea of blood and sea of food. And by chance, it emerges from stomach 30, which is a point of the sea of food. It emerges from there. And that's really, if you look at the points of the Chung Mei, spleen 4 and pericardium 6, they really reflect more its sea of food hat than a sea of blood hat. Spleen 4. And it affects the stomach and the large intestine, the Yang Ming.
All the large intestine, just the connection with the stomach.
It goes there, yeah, because of the connection between stomach and large intestine, which, interestingly, we know there are Yang Ming, but in patterns, we don't have patterns of stomach and large intestine. But in practice, we do. A lot. And you see that, for example, on the tongue. You see that a lot. Say a tongue that lacks a coating, let's say here. Okay, there is a patch there without coating. and the patch is consistently there, because sometimes the patches without coding can change. Let's say it's consistently there. I would say what will be my diagnosis from the tongue is stomach yin shu, because the coding comes from the stomach. But I would say stomach and large intestine yin shu. But books don't have a pattern called large intestine yin shu. But there is. You know what I mean? There's a gap there somewhere. My book doesn't have a pattern called large intestine yin shu. But it does exist, and that tongue shows it. And why not? Stomach and large intestine are yang ming. They're very closely connected. So why can't stomach yin shu kind of transmit to the large intestine? It does. And from the Western point of view, you could have irritable bowel, for example, or candida, for example, to make Western connections.
Cold sores.
Hmm?
Cold sores?
Cold sores, you mean around the lips?
Yeah, or like in the mouth.
Yeah. You mean, do they always reflect a joint pathology of stomach and large intestine? It may be one or the other, not necessarily both. And the chung mei, by the way, goes to both the stomach and the large intestine. And in the gynecology, it explains the vomiting that you may get with dysmenorrhea, or the morning sickness of pregnancy. The changes in the uterus affecting the stomach through the chung mei. And you see the stomach influences the stomach a lot in breastfeeding as well. So in lactation, after childbirth, the menstrual blood goes up in the chung mei. It changes into milk. The chung mei disperses in the breasts. So the periods stop, and the blood turns into milk in the chung mei and the stomach channel. See, these quotations are interesting because they stress the connection between stomach and on the one hand stomach and small intestine, and the other stomach and large intestine, which I see a lot in practice. But in the patterns, in the so-called patterns or so-called syndromes, we don't have them. Like stomach and small intestine as well. Yin shu or heat together, they can have heat together, blood stasis together, and yin shu together. And this book mentions that when the two young channels of stomach and large intestine are diseased, food is not digested and transformed, and the disease affects heart and spleen. Okay, lastly, the extra meridians. The menstrual function would not occur without Du, Ren, and Chung. So everything we said about the tide of kidney yin, kidney yang, liver blood, all that, how does it actually happen in practice? Through Du, Ren, and Chung, because these three are the only three that go through the uterus. Some books say they start from the uterus, or some books say they go through the uterus, and they emerge at Ren 1. And Ren represents the yin part of the cycle, estrogen. Du represents the yang, the minister of fire. and Chung represents the blood. So you cannot treat gynecological problems without treating Du, Ren, and Chung. And all the books say the same thing. Chung, Ren, and Du are 3 branches from the same source. Li Shijian says that too. The Chung Mei is probably the most important in gynecology, especially with regard to blood. The Chung Mei is the sea of blood. Therefore, any most menstrual irregularities, especially those with blood stasis or blood heat, are pathologies of the Chung Mei, especially those. Which is also called the blood chamber in Chinese, in some gynecology books. The blood chamber is hot when there's blood heat. So blood stasis is the most important one, blood heat, and also to a certain extent blood deficiency. And the pathology of the Chung Mei causes another well, not necessarily always gynecological, another pathology called rebellious Qi of the Chung Mei, which we're going to discuss later when we talk about pathology. The pathway of the Chung Mei is very interesting because it's very complex. That's the first branch. This one. I've divided the pathway into 5. I call that the internal branch, from the uterus, the kidneys, uterus, verm 1. That's the second one. This one, it goes all the points from kidney 11 to 21 and scatters over the breast and goes over the throat. This is very significant. It emerges from stomach 30, by the way. Stomach 30 is called Qi Chung, and that Chung is the same Chung as Chung Mei. And this is very significant. What does that mean? It goes through all the points from kidney 11 to 21. Why is that significant? Because the X is a characteristic of the extra meridians that they don't have their own points. One of the characteristics do not have their own points, but they meander. The Yang Chao Mei is a good example. It starts from the bladder channel in the foot, it goes to the gallbladder, small intestine, triple burner, large intestine, gallbladder, all the Yang channels. It just meanders from one to the other. But, so 5 do not have their own points. 2 are different. Du and Ren are different because they do have their own points. That's why the Du and Ren are extra meridians, but they're also normal meridians. Some books talk about, not about the 12 channels, but the 14 channels. So 5 and 2 and 8 make 7. That leaves the Chung Mei out, and the Chung Mei is a special case. is in between those two. It does not have its own points, but almost its own points, but almost. What do I mean by almost? Because it goes through all the points between kidney 11 to 21. Kidney 11 to 21. So why is this significant? It has quite a big significance because take the Ren-May. To influence the Ren-May, you could do lung 7 and kidney 6. Okay? The opening points. But if I do Ren-4, I'm also influencing the Ren-May. I'm strengthening the Ren-May. That does not apply, for example, to the Yang Chow Mei. The Yang Chow Mei goes through bladder to small intestine 10. But if I use small intestine 10 only on its own, it won't do anything to the Yang Chow Mei. Do you know what I mean? So the Du and Ren are different. And the Chung Mei is somewhat in between, i.e., if I use any of these points between kidney 11 and 21, you do have an effect on the Chung Mei. And 4 I use a lot are kidney 13, kidney 14, kidney 16, and 21. And I use kidney 13 especially to strengthen the Chung Mei in deficiency conditions, or consolidate the Chung Mei. I use kidney 14 to move blood in the Chung Mei. Very important point, to move blood. I use kidney 16 to harmonize heart and kidneys. Establish the connection between heart and kidneys. When there is rebellious chi of the Chung Mei. And I use kidney 21 to subdue rebellious chi of the Chung Mei. And remember, this is very significant that it scatters over the breast in gynecology. Premenstrual breast distension, breast lumps, and breastfeeding problems. All of those may be a pathology of the Chung Mei. Then it has a face branch, what I call a face branch, from the throat through the chin, around the lips and to the eyes, which is actually common to the Ren-Mei. The Ren-Mei does the same. Which, interestingly, you see where you see that pathology, many different pathologies, especially if they are related to the menstrual cycle. For example, skin eruptions around the chin that appear with the menstrual cycle are related to this. Cold sores around the menstrual cycle. Acne. Mouth ulcers. They can all be pathology of the Chung Mei if they are related to the menstrual cycle. Let's say they come always before the periods with regularity. The hirsutism that you may get in polycystic ovary is also due to this, to the Chung Mei. The growth of hair is due to the Chung Mei. because if they have amenorrhea, there is no blood loss, so the blood of the Chung Mei nourishes the growth of the hair, which is also the reason for the growth of hair after the menopause. And then it goes up the spine, and that explains menstrual pain that is experienced in the spine rather than the front. And finally, there's the descending branch, the leg branch, which is a very interesting branch because it has many different aspects to it, but one of them is that it brings yin qi down to the legs. And notice something unique here to the Chung Mei. From stomach 30, it goes up, but it also goes down. It's the only channel that does that. From one point, goes up and down. No other channel does that. Which indicates somewhat its nature, a very strong qi, powerful qi that can go up and down at the same time. And in gynecology, where do you see the pathology of descending branch? Sometimes when dysmenorrhea radiates down the thighs, that's due to that branch. Of extreme importance, that branch in gynecology is the use of liver 3, because that branch goes to liver 3. So whenever you're using liver 3, you're activating the Chung Mei. The Tai Chung, that Chung is the same Chung as Chung Mei. And indeed, in chapter 1 of the Su Wen, the Chung Mei is called the Tai Chung vessel. Plus, I repeat, in my opinion, I think spleen 6 is also a Chung Mei point. But that's only my view. So, as you can see, the Chung Mei influences almost the whole body, except the arms. Yeah.
How do you see the pathology of Chung Mei connected with the thumb,
With the
with the organs? I mean, like it's Chung Mei pathology, but
it's strongly connected to the liver.
with the liver.
To the liver.
How are they?
The blood stasis of the Chung Mei is also blood stasis of the liver. They are inseparable, actually. The blood stasis of the Chung Mei is also blood stasis of the liver, and we treat it through the liver. The rebellious qi of the Chung Mei, where does that qi rebel through? A lot through the liver channel. So there is a strong connection, but in deficiencies of the Chung Mei is very much a kidney, connected to the kidneys in deficiency, and sometimes the spleen too. Say when the Chung Mei is not consolidated and there's menorrhagia, spleen and kidneys. So different organs, and the heart very much. The Chung Mei is one way, well, the only way, in my opinion, in which the heart is connected through the uterus.
So it's important to see the organs in the channel
Yes.
unified, and we say Chung Mei pathology, but that doesn't mean only the channel.
Exactly.
It's coded to.
Yeah.
Shows that the both are.
Yes. And you need to treat them. Let's say you have blood stasis in the Chung Mei, you treat the Chung Mei, but you must treat the liver with liver 3. If heart qi is not descending, you need to treat the heart, etc. The Chung Mei is connected to almost every Zangfu. Almost. The heart, liver very much, kidney very much, spleen, lungs probably the least of all, stomach, small intestine, large intestine, not so much gallbladder maybe yes. Yeah, and nearly every Zangfu. And that's why the Chung Mei is also, one of the names of the Chung Mei is the sea of the 5 Zang and 6 Fu.
Seems to me that the pathway of Chung Mei
Certainly at points like stomach 30, it's most obvious. It seems to follow the course of major arteries.
Yes.
And so, I'm wondering if when they first conceived of this chongmai, they're looking at the same body as we're looking at now, basically, and that they noticed that connected with
That throbbing, yeah. All the old books, when they talk about stomach 30, they say it's near where it throbs.
Mm-hmm. The chi idea, the chi thoroughfare or chi jia.
Well, that's another aspect. The Chungmei has so many different aspects. One is the Sea of the Five Sang and Six Fu, and as we have analyzed, is related to Omo Sang Fu. It's the Sea of Blood, and is the Sea of the 12 channels. So the Qi Jie, the streets of Qi, etc., etc. We're going to talk about that more when we talk about pathology. And that's why in some of the old books, when they compare the external radiance to a family, and the Chungmei is the father, i.e. the most important in those times. In Confucianist times.
Now we're relegated to the back seats.
Oh, no.
Tolerated, maybe.
Okay. So the hormonal changes of Western medicine occur in Chinese medicine primarily through Ren, Du, and Chung. The puberty and the menopause, the changes of puberty and menopause. In fact, chapter 1 of the Su Wen says at 49, the Ren Mei becomes deficient, the Chung Mei depleted, and the Tian Gui dries up. An interesting thing about the Chung Mei is the Sea of Blood, and the Ling Shu for the Sea of Blood has those 3 points. I've never seen an explanation of why those 3 points. But I do know a doctor in Nanjing who used those 3 points to affect the Chung Mei. Bladder 11, stomach 36, and stomach 39. I use stomach 37 and 39 actually to affect the descending branch of the Chung Mei, even though the descending branch of the Chung Mei is on the inside of the leg. I think those two affect, influence the descending of blood and yin to the legs. I use them for restless legs, together with spleen 6. That's a diagram that is, it's a great diagram to summarize the energetics of the Chung Mei. Notice those arrows, there's 3 going up and 3 going down, and those 2 diagonal. Let's look at them one by one. It's the Sea of Blood, there's the upper Sea of Blood and the lower Sea of Blood, these are called. Bladder 11, stomach 37, 39. From stomach 30 goes down and up the kidney channel. It goes to the eyes and to the feet. Through the descending branch it goes to the feet. To the abdominal branch it goes to the eyes. It goes to the exterior and the interior, the abdomen and the spine. And in fact, I have this diagram is not from a Chinese book, but I have worked it out from the Lei Jing. I don't know if we have this. No, we don't have that text here. No. But there's a passage in the Lei Jing that talks about the Chung Mei, and it highlights that how it goes up to the upper sea of blood, lower sea of blood, kidney channel, legs, etc., etc. And that's where this diagram is derived from that passage in the Lei Jing. By the way, if you look at that feet and eyes and kidney channel, here it goes through the face and eyes and feet. This, you remember earlier we talked about the first explanation of contradictory hot and cold symptoms in women, which was a simultaneous deficiency of kidney yin and kidney yang. This is the second explanation of contradictory hot and cold symptoms. Qi of the Chunmei goes up, it gives you a red face. It doesn't go down the leg branch, it gives you cold feet. Hot face and cold feet. It happens all the time. Well, not all the time, but very frequent. And that's one explanation of it. And that's not full heat or empty heat. It's just Chunmei pathology. So if we want to compare the Chunmei to the Renmei in gynecology, I would say the Chunmei, what is the main differentiation? Because there's a big overlap between the two. They both control the life cycles, fertility, puberty, menopause, both of them. They share a common pathway here, on the throat, around the mouth, into the eyes. It's a common pathway. The main differentiation is between yin and blood. That's one way of differentiating them. Chunmei is blood, Renmei is yin. So Renmei is better to nourish yin, kidney yin. In terms of diseases, the Chunmei is the vessel to use for painful periods or endometriosis. Renmei, more or less everything else. Irregular periods, no periods, late periods. But of course, I repeat, with the big overlap between the two. And generally speaking, I think more the Chunmei in full conditions, more of the Renmei in empty conditions, of course with many exceptions. Let's say a woman has an infertility from a kidney deficiency, the first thing I would think of is the Renmei. But if she has infertility from blood stasis or damp phlegm in the uterus, the first thing I would think of to use would be the Chunmei rather than the Renmei. The Dumei is the forgotten channel in gynecology. It controls the yang and therefore that tide of kidney yin and kidney yang. Without Dumei, there wouldn't be a menstrual cycle. It corresponds to the minister fire, the kidney yang, the increase in temperature in the luteal phase, all of that. And the Dumei represents the minister fire, which promotes that transformation of kidney jing into tiangui. Therefore, it is crucial. Moreover, of huge significance in gynecology is this, from chapter 16 of the Ling Shu, that the Dumei goes through the front of the body. Flows to the genitals. And another chapter of the chapter 60 of the Su Wen confirms that it goes to the penis in men and the vagina and vulva in women. So it goes to the front of the body, where in an area which we would naturally associate with the Renmei. Let's say if a woman has vaginitis, the first thing you think of obviously is the Renmei. So why would we think of the Dumei? We would think of the Dumei if she has vaginitis, but with the pronounced kidney yang shu. So the Dumei can influence that area as well. And that should not be forgotten. Moreover, a third reason, the Dumei has an abdominal branch, which goes up the abdomen, basically the same as the Renmei. Li Shijian talks about it. Another branch of the Dumei starts in the lower abdomen, comes up the abdomen to the umbilicus, the heart, notice that, the heart, throat, chin, eyes, following the pathway of the Renmei. So in other words, Ren and Chung are a circle. Crossing over inside Ren. Sorry, I said Ren and Chung, I meant Ren and Du. Du and Ren. You could look upon them as really one channel, half yin, half yang, crossing over internally. And for that reason, very often when I use the Dumei in a woman, I often combine it with the Renmei. So in a woman, I might use 4 points, small intestine 3 and bladder 62, together with lung 7 and kidney 6. And that's about the only time that I use 2 extra meridians. I know that there are people that use 2 extra meridians, but I don't. For example, I would never use the Chung Mei and the Yang Chao Mei, or Ren Mei and Tai Mei, or Yang Wei Mei and Chung Mei, etc. But the only exception I do is when I use the Du Mei in a woman. And why do I make that exception? Because of this. They really are like one circle, one channel. And Li Shijian says that. He says they're like midday and midnight. That's the abdominal branch from the Su Wen, chapter 60 of the Su Wen.
Is the reason for not choosing more than one just sort of respecting the
People do that. I don't, because I don't see situations in pathology when you need to do 2. You know what I mean? It's either a Yang Chao Mei pathology or a Chung Mei pathology. Or if there is both, I would do 1 at a time. But there are people, I've just recently read someone, I've forgotten which book, that someone used all 8 of them in sequence. I forgot where I read that. But I don't. Another important aspect of Du and Ren is that they start from the kidneys and both of them go to the heart. So they help that vertical axis connection. Both of them go to the heart. So they help that vertical axis of heart and kidneys in gynecology, which, by the way, has other aspects in other areas. In gynecology, the DIMA also has its influence. We'll just finish with this and then we'll have a break. The DIMA is the only vessel that is horizontal. And its pathology in gynecology, the main one is dampness. Dampness infusing downwards. And the DIMA can have a Shu or a Sure pathology. And its Shu pathology is kind of connected to the Ren Mei, and its Sure pathology connected to the Chung Mei. So if a woman has dampness, let's say, manifested with excessive vaginal discharge, vagina would suggest the Ren Mei. Why would you use the Ren Mei? Or the Dai Mei? Which one would we use? Why would we use the Dai Mei? Yes. And how would you know? From?
Oh, in terms of symptoms?
Yeah. I would be guided a lot by the pulse. There are pulses which are typical of the extrameridians. Say a woman has dampness infusing downwards. Dampness infusing downwards can come from a spleen and kidney deficiency, leading to dampness. It infuses downwards. So there's vaginal discharge. You could use Ren Mei. Why not? Ren Mei. You could use lung 7 and kidney 6. Do 20 to lift chi. Ren 12. Stomach 28 to resolve dampness. Maybe Ren 5. Spleen 6. Then afterwards in the back, do bladder 20 and 22, for example. That would be a good treatment. So when would I do the Dai Mei? I think when this pulse is wiry. The Guan position of both left and right, the middle position. Then I would do the Dai Mei with gallbladder 41, triple burner 5. But I would do some of the other points would be similar though. There would be stomach 28. But because we're using the Dai Mei, we might use, I would use gallbladder 26. And spleen 9 or spleen 6. So I'm guided somewhat by the pulse too when I choose an extrameridian. Have you got this diagram? No? Okay, shall we have a break here? You can copy that, will you?
eyes feel more open and she can see better after.
Sorry, who's that?
A bipolar patient.
Oh, really?
Semester.
Did I see them?
No, I don't think.
And every time you use the dye or the chung.
It's dampness. I mean, her constitution is dampness, aside from her psychological issues. Actually, they're not separate. So I want to look for this pulse now in her.
Of course, that does not mean, don't misunderstand it, that if the pulse isn't like this, you can't use the dye. Yeah? It doesn't mean that. What I'm saying is if the pulse is like that, it is a very clear indication for using the dye. But it doesn't mean you can't use it if the pulse isn't like that. The same for this, for the chung mei. Yeah.
Two questions. First, is this Lisha Jen's?
Lisha Jen, yeah.
Teaching online?
Yeah.
Okay, and then the second one is, again, so I'm still struggling with relating the Zang Fu and the Jingguo. So we understand this is a Chongmai pathology, and that guides us to certain conclusions about what we need to do via the channels. But then, do you think it's also necessary to understand why from the Zang Fu perspective, or you presume that by balancing that will...
No, I personally still think it's important to understand why it's happening. Yeah. Personally, yeah.
Treatment that aims to correct that as well?
Definitely, yeah. In my mind, I keep two hats as well. The acupuncturist and the herbalist, the channels and the Zang Fu. And I use both. Yeah, definitely. You can use that treatment blindly. You feel the pulse there, use the chung mei, and you use it blindly, that's it. And it will work. But for me, that's not enough. I want to know what pattern there are, why there is, what else there might be, etc., etc., etc. And I keep two hats also because I do both acupuncture and herbs. So the herbs might be more directed to the Zang Fu, naturally, and acupuncture to the channels.
But the connection, you understand that there is this Chongmai pathology because of some Zang Fu imbalance, or sometimes it relates, sometimes it doesn't?
No, because of its Zang Fu imbalance, yeah. Yeah. Yes. It's not separate from it. But it is great to see because you see the extramedullary pathology, especially in complicated conditions. The chung mei is a good example of it. If you look at all the symptoms of rebellious of the chung mei, if you look at them from the Zang Fu point of view, it's a mess. Every Zang Fu is involved. But if you put them all together, it's the chung mei pathology.
That
Yeah.
also involves those organs.
It also involves those organs.
Tied together.
Yeah. Yeah.
So without the channel part, you wind up doing acupuncture that just this.
Without the channel part.
Yeah. In other words, one would think, okay, I'm thinking as an herbalist, and then choose points just based on that, without an understanding
No.
of the channels that tie.
There's nothing wrong with doing that. I know this is criticized a lot, the herbalization of acupuncture. It's criticized a lot. I personally don't think there's anything wrong with it, but it's not enough. It's not enough. The acupuncturist hat and thinking is different.
Not enough because you think it's more effective, personally, to...
Because, yeah. And I also feel that this criticism, this herbalization of acupuncture criticism is sometimes misguided because people say it's modern, and it's not true that it's modern. It's not true. Because when the Nanjing says that the shu points, the Jing point is for mental restlessness, right? The Ying point is for hot feelings of the body, and the shu point is for aches and pains, etc. What is it saying? When it says it's for hot sensation of the body, what is it saying? It's saying the Ying points clear heat. It's not saying that but it does mean that. So is that the herbalization? Do you know what I mean? Anyway, let's go on. So let's start talking about some pathologies, starting from kidney deficiency. Have you got this in your handout? Is that your next thing? And you got this diagram?
Yes.
What page?
31. In women, especially of over 40, as I said, a deficiency of the kidneys nearly always, not always, but nearly always involves both, but it's never 50-50. It's always predominantly kidney yang or predominantly kidney yin. But as you can see from these diagrams, they are both deficient, and that's why in infertility, if you look at all the infertility prescriptions for kidney deficiency, they all reflect that thinking. You need to tonify the yin because it's the egg, and you need to tonify kidney yang because it's the heat necessary for the follicle to change into an ova. And that accounts for many contradictory symptoms which you should not be surprised of. Night sweating with cold feet, night sweating with frequent urination, feeling cold in general and hot flushes, or feeling cold in general, hot feet. The crucial thing here is the tongue. The pulse doesn't help you very much. I know they say the right is kidney yang and the left is kidney yin, but it's not that. I don't think this rule is that reliable. In my experience, most women I see with the kidney deficiency over 40, they are both deficient. They both should. In my experience, the most common finding. So the pulse doesn't really help you very much to distinguish yin shu from yang shu, unless, of course, it's floating empty, in which case it would indicate yin shu, or unless it's very slow, in which case it would indicate yang shu and cold. But the tongue is much easier, much more straightforward, because in yang shu the tongue is pale. It's as simple as that. If it's not pale, it's not kidney yang shu. And in kidney yin shu, contrary to what everyone says, the tongue is not red, but without coating. Okay? You're clear about that? It's the lack of coating that shows yin shu, or to put it differently, yin shu manifests with a lack of coating. And yin shu is a very gradual process. It's not something you just either have or not have. It's very gradual. It develops over many years. It declines over many years. And eventually, yin shu will give rise to empty heat. But you can have many years that you don't have empty heat yet. And that's very important to understand in treatment. I see a lot of confusion about this. I got a diagram here that clarifies that a lot. And the tongue is the most reliable sign. Yeah, this is a good example. Look at these two tongues. They are a very good example. These two tongues side by side. This one has no coating. Yeah, that's good. No coating, deep cracks, but it's not red. If anything, it's probably even pale. So that's what? Severe yin shu, but no empty heat yet because it's not red. See that? Mm-hmm. This one, the same, no coating, except a little bit of coating there. Cracks, it's dry as well, but it's tending to red. So here there is empty heat. Here there is no empty heat. Here there is empty heat. So what they have in common is the yin shu, which you deduce from the lack of coating. What's the problem?
Well, not this. This is clear. The question I have is that when you have this mixed picture of yin and yang shu, and it seems like that happens more at night.
If you have a mixture of yin and yang shu like the diagram I had before, it's always one is predominant.
Right, but this seems to happen more.
And the tongue is either pale or not pale. Yeah. If there is a confusing mixture of yin and yang shu, and the tongue is not pale, there is a predominance of yin shu. It's as simple as that. And you use nourish yin. Even if there is a coat? No. Let me see. If there is a confusing mixture of symptoms of yin and yang shu, and the tongue is not pale, yes, I would say even if there is a coating, nourish yin. Especially if we're talking about a menopausal woman. Are we talking about a menopausal woman or something more specific or what? Depends what we're talking about. Huh?
I like that example.
Yeah.
Because you see the tongue doesn't have lack of coagulation.
Yeah. Just a moment. So if a menopausal woman has a tongue like this is a man, but let's assume there was a woman has a tongue like that, she has severe yin shu, but no empty heat yet. If a menopausal woman has confusing symptoms of deficiency of both and the tongue is not pale, I would nourish yin even if there is a coating. Yeah. Yes?
I just find it difficult. I mean, I have some patients right now that it's like, is it more yin shu? Is it more yang shu?
Yeah, but don't assume that every contradictory hot and cold symptom is a result of this. So.
Well,
there are other factors which we're going to look at actually.
Yeah, I'm talking about a woman in her 50s particularly.
Okay.
Hot flashes.
Okay.
But also it's cold.
Okay. And how's the tongue?
The tongue shows it's like the one on the left. Yeah.
Oh, it's definitely yin. It's definitely yin shu.
Yeah, but there's no coat.
Well, it's definitely yin shu.
No, that's how she's been diagnosed. And one of the supervisors here, without any success at all, for 2 years of treatment, Giovanni Maciocia, and then one of the supervisors last week decided it was more yang shu, gave her Gynaecology.
And did it help?
And it helped. It was like the first time in 2 years the night sweats went away. It was interesting. But then she got cold hands and feet from never having experienced that. So it was like, she took the hot herbs and it's very bizarre. And I was just like, okay.
But you know what happened, I think?
Yeah.
Was her tongue swollen?
Yes.
She probably had phlegm.
Yeah, she's also edematous.
Edematous, is she overweight?
Yes.
Yeah. She had phlegm. The reason Gynaecology helped is probably that it moved the phlegm, resolved phlegm. Yeah. Not so much that it tonified the yang. And that's probably why it made their hands cold.
Yeah, that's good.
Because this tongue here, this one here, you see, that's actually a good example of a menopausal tongue. Because the menopausal symptoms are due to kidney deficiency, that is true, but they don't occur on a vacuum. Any woman over 50 will have other pathologies. A very common one is phlegm. And this tongue shows it very clearly. This tongue shows severe yin shu, empty heat, and phlegm because it's swollen. Herbally, supposing this was a menopausal woman, this one, I would give her, the lighting here is not good. You can't see it very well. I would give her Zhuogui 1 variation of, with herbs to resolve phlegm. Zhuogui 1, change it a bit, making less yin nourishing, and adding Banxia, Fuling, and Champi, and Gualuo.
You have to be careful not to dry it too much, or you...
No. You know, yin shu and phlegm are very common together. I can show you dozens of swollen tongues without coating. Dozens. And one of the methods of phlegm is resolved in many different ways. One of them is nourish yin and resolve phlegm. In the elderly, the two together are actually a treatment principle. There is tonify qi and resolve phlegm, tonify yang and resolve phlegm, move qi and resolve phlegm, reinvigorate blood and resolve phlegm. There is also nourish yin and resolve phlegm. It's a very common pathology that we see in our patients, a swollen tongue without coating, yin shu with phlegm. That's what I would do. This one, number 4, it's gone a stage much further. See, this 1, 2, 3, and 4 are more or less, all these are different patients, is like a progression. From that, 1 to 2, 3, and 4. 4 is the worst. It's the most severe yin shu and most severe empty heat because it's darker red. This patient was dead 2 weeks after taking this picture. Liver cancer. Okay? So don't confuse yin shu with empty heat. With empty heat, the tongue is red without coating. With yin shu, without empty heat, the tongue is without coating.
How come we don't talk about the stomach yin?
About what, sorry?
The stomach yin deficiency.
What about it?
How come we don't discuss any of that?
He does.
He does about it.
Stomach yin. I talk about stomach yin shu all the time.
Yeah. No. The comment we made earlier. Because when I was a first semester student, I asked about stomach yin, and all my teachers were like, "Oh, you don't really see it. We talk about that."
You see it all the time. All these tongues without coating. Look at that one, for example. This one. All those tongues without coating indicate stomach yin shu. In addition to stomach yin shu, there may be yin shu of other organs, which is not always apparent from the tongue. That man here, you can certainly say that he's got stomach yin shu, but he may have liver yin shu or kidney yin shu. We don't know it from the tongue.
You're saying that just because of the trappings in it? Or because
No, because of the lack of coating, and the coating comes from the stomach. By definition, lack of coating indicates stomach yin shu.
If you have a kidney yin deficiency without a coating on the tongue, you're always going to have...
I would say they have kidney and stomach yin shu. But there is nothing on the tongue that tells you specifically liver yin shu or kidney yin shu. This man could have liver yin shu or kidney yin shu or lung yin shu. Do you know what I mean? I don't know where that diagram is. We'll have to leave it. Yeah, these are the yin shu tongues. In all these cases, there is stomach yin shu. But here it will be stomach and lung yin shu. Here will be stomach and liver yin shu. That's stomach yin shu. That's stomach and intestines yin shu, which I mentioned before. These are all partially peeled tongue, and they all indicate stomach yin shu in addition to other organs: lung, intestines, kidneys, liver. No, I don't have that diagram here. I don't remember where it is. Yes. Often, yes. Very often. And they would look like this, typically. Not always. Antibiotics don't always do that. It also depends on the type of antibiotic. But this one. That one would be typical. That one. Yeah. Or this one too. But more this one.
Have you ever seen food reactions decoating off in the stomach deficiency?
Food reactions?
Yeah, like someone's allergic to.
Yeah, they can do that, yeah.
Does that ever throw you off?
No, that would indicate, still would indicate that they got the tendency to stomach yin shu. Whatever the food is doing, it is injuring the stomach. Yeah. So, to go back to this, it's as simple as that. In kidney yang shu, the tongue is pale. In kidney yin shu, the tongue is without coating. If it is very advanced and there is empty heat, it would also be red. But in menopausal conditions, we might as well talk about that now. In answer to your question, if the tongue is pale, I would tonify kidney yang. In every other case, I would nourish kidney yin. Basically, it's as simple as that. Okay? But there are other causes of contradictory hot and cold symptoms in women, and this is a list of 4 of them. The first we've already discussed. Have you got this? Yes. Yeah. The first we've already discussed, a simultaneous deficiency of kidney yin and yang. That's one reason why I like Yogui 1 and Zhuogui 1. The second is rebellious qi of the Chung Mei. We're going to talk about that when we discuss the extra meridians. But basically what happens when there is a deficiency here in the lower dantian, in the Chung Mei, and the qi of the Chung Mei rebels up. And if you remember, the path of the Chung Mei goes to the face. So it gives a feeling of heat. And because rebelling up, it doesn't go down to the feet in the descending branch, and you get cold feet. Plus, of course, other symptoms in between. We're going to discuss that later. And this is very common. And this is not full heat or empty heat. It just is a Chung Mai pathology. It's neither. And it's not the sun syndrome because it's not cold hands and feet, it's just cold feet. Third, women can get empty heat from blood shoe, which men don't usually. Unless they have a skin disease, they can. And 4, which applies equally actually to men and women, is yin fire. It's another common cause of heat above and cold limbs. Okay, so these 4 explains contradictory hot and cold symptoms. And the first 2, I would say, are the most common ones in women.
What do you mean by yin fire?
Is the famous yin fire, Li Dong Yuan.
So what I don't see on the list is false heat.
Yeah, of course. Yeah, the 5th would be false heat, yes. Okay, so that's the kidneys. The liver, let's talk about the infamous liver chi stagnation. I always talk against it, but it does exist in women. It is common. It does come from emotional stress. What?
Is that a sigh? A sigh is just a sigh. Acting out the pathology.
It does come from emotional stress, which, however, is not always anger. It can also be other emotions like worry, shame and guilt. And it's particularly manifesting itself in phase 4. However, I always say, do not assume that all premenstrual symptoms are always due to this, because they are not. Interesting, the tongue and pulse in liver chi stagnation. Chinese books will say that in liver chi stagnation the tongue is purple. Don't believe it. Not true. For me, the tongue body color reflects blood more than qi. And qi is non-substantial. So for me, a purple tongue definitely indicates blood stasis. And blood stasis is a stage kind of far more advanced than qi stagnation. So how is the tongue in qi stagnation? The tongue may not change at all. Tongue may not change. And we see that all the time. A woman who may have severe liver chi stagnation, a lot of premenstrual symptoms, but the tongue is relatively normal, or at least normal color. What does happen in liver chi stagnation when it's severe is a redness on the sides, not a purple color. Redness. If those 2 sides were purple, I would definitely say there is liver blood stasis. With redness, I would say severe liver chi stagnation. And this is very relatively common. A lot of people have redness on the sides. Yes?
What about the color dark? Rather than the purple.
Rather than the it will be dark red. So more severe heat, which I would not associate with liver chi stagnation. I would say it's going to stage much further of severe heat. or fire.
How about what some people call dusky?
Yeah, I hear dusky a lot,
Yeah.
and it's only in California.
I don't know what you're.
I was speaking to a colleague of mine in Massachusetts from NISA, and he said he's never heard of a dusky color.
Well, I think it's a translation of ah.
Is it?
Yeah.
But how did it
And what's the interpretation of it?
That it means that it's. I mean, I've used it for years, so maybe you've heard it from me.
Yeah.
But the interpretation is chi stagnation as opposed to blood stasis.
As opposed to blood stasis.
Yes. In other words, before purple. That's why I was asking you what you thought of an.
Mm.
As I learned it, and I think I see it in Chinese books associated with the liver chi stagnation.
Mm.
And it's purple, but I don't have one in front of me.
I'll have to check.
That's what I.
I'll have to check.
So it's like a slighter darkening. And
Yeah, it's
So it's a darker than red.
like the end of, like now, at time. It's not purple, it's not black, but it's dark, darkening, like
Mm-hmm.
it's bluish rather than purple.
Stormy.
But I would call bluish blood stasis, though.
Yeah, well, yeah, again.
I would attribute. I'll check. See what.
You have to publish that.
That's a good example of red sides. That's a great example. Red sides. Yeah, actually, you lose a lot. There's a lot of change in color when you project it.
Yeah.
It's not so dark. It's quite different here.
Oh yeah.
You see?
They use the term qing in this particular. Qing is qi or blood, not moving freely.
I know Chinese books do say that, but
You disagree?
I disagree. I disagree.
What about when you see the purpleness that's not, that changes? That one day it can be confused with purple, and then the next day not.
I don't see that much, do you?
It's getting purple right after you eat. Right after eating.
I don't know. Maybe I'm wrong. Maybe purple can indicate chi stagnation, but I don't know. That's what I think. Okay. An interesting thing about the liver pathology in women, which seems to happen more in women than men, are two things. This is one which we've already seen. The fact that liver chi stagnation is either associated with or deriving from blood sugar. And that's what Xiaosan is for. And Xiaosan is a gynecological formula, originally. It's in a gynecology book. And this explains why a woman can have all the symptoms of. Okay. Oh, there is another pulse for heat, which I forgot. An important one is overflowing. An important one. Overflowing pulse. It's like, it doesn't have to be overflowing everywhere. It could be overflowing only on the liver. Right with that. Yeah, Hungma, yeah. if this is the liver pulse, the overflowing pulse is like that. It goes beyond, and it's more superficial, and it's beyond it. And occasionally it could be like that in the heart as well, in women. Heart blood heat affecting the periods. Heat causing menorrhagia is very common, and I personally think, or not think, I've observed that there is a bias. We have a bias in menorrhagia towards Chishu. Definite. I've seen it definitely. Some people, well, more people attribute to Chishu than blood heat.
How often do you see both?
Both? Interesting. You could have both in complicated, long-standing conditions, yeah. You can. But excluding the situation when you see both, I would say is roughly, my experience, roughly 50-50. 50 Chishu and 50 blood heat. Roughly. And remember that blood heat is often doesn't cause that major symptoms in women. Overflowing, rapid pulse, red face, agitation, insomnia, thirst. It doesn't have to be like that. It can be slightly red face, slight occasional thirst. The pulse is a bit rapid, but not that overflowing, etc., etc. The symptoms are often not as dramatic as they are in the books, and we may miss them. And when we do bungalow, I'll give you some examples when we talk about bungalow. Some interesting examples from real patients. Okay. Blood stasis, major pathology. Extremely common. It is also Chungmei pathology, as well as being a liver pathology. And as I said, my clinical tip would be in chronic, complicated gynecological conditions, always suspect blood stasis. And let's look at the symptoms of blood stasis, the gynecological symptoms of blood stasis. By the way, an important factor about blood stasis, people give so much importance to Chi stagnation, but you can't get any serious disease from Chi stagnation. You can't get a myoma from Chi stagnation. You can't get carcinoma from Chi stagnation, a tumor, an abdominal mass, a stroke, coronary heart disease. You can't get any of this from Chi stagnation, but you do from blood stasis. By that alone, blood stasis should occupy our attention. It's a major pathology which potentially leads to serious diseases. In the field of gynecology, what does it lead to? Myoma, endometriosis, carcinomas, of course, carcinoma of the breast, fibroadenoma of the breast, just to mention some, objective, physical, serious diseases. Not to mention other things like infertility or painful periods or whatever. And blood stasis always derives from something else. There isn't a food that leads you to blood stasis or an emotion that leads to blood stasis, although, if you remember, in my opinion, guilt easily does. So blood stasis always derives from something else, and that something else is primarily these three. Chi stagnation may turn into blood stasis, cold and heat. In gynecology, these are the three main ones. And the first and the third, chi stagnation and heat, derive from emotional stress. The second doesn't. The second derives from external cold, from cold, invasion of cold in the uterus, possibly combined with diet factors. Okay, so 1, chi stagnation, 2, cold, 3, heat. The main ones. Phlegm doesn't usually cause blood stasis, but it aggravates it. And the interaction of these two is particularly pernicious and dangerous. In women, where do you see it? You can see it in polycystic ovary, in ovarian cysts in general, in endometriosis. The same main things I mentioned earlier. Polycystic ovary, endometriosis, a myoma, and a breast pathology like carcinoma or fibroadenoma. A combination of the two. And it's a pernicious combination because they aggravate each other. And that is the reason. Because there is an exchange between blood and body fluids. You remember body fluids go in and out of the blood? You remember that? And phlegm is a pathological accumulation of body fluids. Blood stasis is a pathological accumulation of blood, so the two interact. And how do we know? The pulse is a combination of slippery and wiry, which is relatively common. The tongue is swollen, indicating phlegm, and possibly purple on the sides. Example, although in myomas blood stasis is predominant, there can be some where phlegm plays a role. The same with endometriosis. The endometriosis blood stasis is predominant, but phlegm may play a role. In polycystic ovary, the opposite, the reverse. Phlegm is the main condition in polycystic ovary, but blood stasis may play a role. And blood stasis becomes a further cause of disease because it causes other patterns by itself. And it can cause blood deficiency. And paradoxically, especially in gynecology, it can cause bleeding. And that's the mechanism. Have you got this diagram? So imagine the red box is the uterus. The blood vessels of the uterus are obstructed by stagnant blood. But new blood is being made all the time. Because the blood vessels of the uterus are obstructed, it cannot enter the uterus and it comes out. And it's a paradox that bleeding is aggravated by blood stasis. And blood stasis is not usually the main cause of the bleeding, but it aggravates it. So blood stasis may be a complication. Bleeding is usually due either to chi shu or blood heat. But both these can be aggravated by blood stasis. And you should look out for it in chronic conditions. And that's why those herbs are great herbs to have, herbs which simultaneously move blood and stop bleeding. San Qi, Pu Huang, Qian Cao Gen, especially these three I use, DU. Shall we have a short break here?
Can it get like super muddy?
Okay, shall we start? So let's talk about the diagnosis of blood stasis with specific reference to gynecology. First of all, pain. It's true that blood stasis may cause pain. It's true that if it is from blood stasis, the pain will be stabbing. However, it's important to remember you don't have to have painful periods to diagnose blood stasis. And even one symptom only in women, for me, is enough. Dark menstrual blood with clots. Even just that. The tongue is normal, the periods are not painful, even just that is enough to diagnose blood stasis. So why is the tongue not purple? Because the blood stasis is still mild.
What about just clots?
Just clots, dark or not dark? Yes, also. Also blood stasis. Yeah. If there is pain, of course, the pain from blood stasis is very severe, stabbing, and it can be either central or lateral. And one sign that would be more typical of it as well would be relieved by the passage of clots. That Chinese saying there is a little tongue twister, bu tung ze tung, tung ze bu tung. It's a play on the word tung, that tung with the first tone means free passage, tung with the fourth means pain. So no free passage, there is pain. Free passage, there is no pain. In the field of gynecology, the second thing that blood stasis can do is lumps. Myoma, you could bet it's nearly always from blood stasis. So is endometriosis. Even endometriosis, officially endometriosis is not an abdominal mass. Officially. Why do I say officially? Because it's a modern disease and it's not characterized by palpable masses. Yet, nevertheless, all modern Chinese doctors say the same thing, that it is a form of abdominal mass. And it should be treated as such. A fibroadenoma of the breast is a lump from blood stasis, and so is a carcinoma of the breast. And so is the carcinoma of the uterus. Yes?
If someone's getting IVF treatment or they're doing the hormone injections, all those different hormones cause blood stasis for them too?
No, I don't think they cause blood stasis, but they do cause, according to Dr. Xia, they do damage the ovaries. And I think more than anything else, will probably cause kidney deficiency rather than blood stasis. The tongue. Let's go down. Let's leave the tongue for the moment. Dark complexion, dry nails, bleeding, maculae. Bleeding, we said why you might get some bleeding from blood stasis. And remember that blood stasis also affects the Shen. That's why we got dreaming a lot and poor memory. These other signs are not really relevant to gynecology except the eyes. These dark rings under the eyes is not always kidney issue, as people think they are. It can be from blood stasis. Okay.
What's that lady's legs? Is that just blood?
Sorry?
Her legs? Is that the picture of that lady's legs?
Those are legs, yeah, those are varicose veins. Yeah. 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 A purple nose like that, by the way, also indicates liver blood stasis. And a purple nose like that, by the way, in face reading also indicates financial disaster. You should never go into business with the person with the purple nose. Because they will have a financial disaster. In face reading, Chinese face reading. You know, reading a person's character and destiny from the face. Which is something.
So there's sneaky partners.
Which is something I learned from Dr. Shen. It's not part of Chinese medicine, but Dr. Shen used to integrate it a lot with his diagnosis. No, this is not palmistry. This is face reading, and it's very accurate, and it's very. I use it a lot. I've learned from Dr. Shen, and it's very useful and very reliable. No, face reading. Face reading. It's very helpful. Very helpful, especially.
I'm thinking of all of the purple noses at AIG or.
Yeah, there's probably an epidemic of purple noses right now.
Yeah, epidemic. Americans with purple noses.
Yeah, probably.
On Wall Street.
No, nothing to do with the 5 elements. It's purely face reading. You know, the face, you can divide the face in different areas, upper, middle, and lower. And each part of the face is related to a year of your life. So that, so that, especially mental emotional problems, you can get an idea. And it's very important. I use it all the time. When it goes back to. You say a woman who's 35 and she's got some emotional stress, you can tell from the face reading whether that goes back a long way to childhood or not. And it is reliable. I know it sounds like mambo jumbo, but it's not. It's not. Yeah, the book I recommend is by Timothy Marr. There are many books on face reading now. There is a lady that does workshops on it. Lillian Bridges, yeah. But my opinion, the best one is a little paperback by Timothy Marr, M-A-R. And it's simply called face reading. I think it's the best. It's out of print, but you might find it secondhand. Okay, and so let's talk about the tongue. because that's very important. All the books will say in blood stasis the tongue is purple. That is true. However, I've seen loads of women with blood stasis, very clear blood stasis, painful periods, dark clots, and the tongue is normal. So I've got here 4 stages of blood stasis. If a woman has painful periods and dark blood with clots and the tongue is normal, it means simply that the blood stasis is mild or has been that not very long. The second stage would be that these veins become purple. The third stage will be that the sides are purple. And the fourth, the whole tongue is purple. So when you read in the books the tongue is purple, that's true, but that indicates a very advanced stage of blood stasis, which you might see only in an elderly person. And remember that these sides reflect the liver, but in women it also reflects the uterus. So that's, if a woman has blood stasis in the uterus, it will be reflected here on the sides, not on the root, where you might expect it to be, because the uterus is in the lower burner. So that's very important to understand that there are 4 degrees of severity, 4 stages. And that's a lady with blood stasis and a normal tongue. Those are distended veins, dark, purple sides, and the whole tongue purple. So, other little manifestations of blood stasis, gynecological manifestation of blood stasis are these. A period that starts and stops. A period that starts with a brownish discharge or ends with a brownish discharge. And the firm pulse, as I defined it earlier. Okay? And remember, they don't necessarily always have painful periods. With the purple tongue, you must distinguish 2 types of purple, reddish purple and bluish purple. And that's reddish purple, and that's bluish purple. Probably in gynecology, the bluish purple is more common. And the bluish purple derives from cold or yangshu, and the reddish purple derives from heat. So, in other words, a pale tongue with blood stasis turns bluish purple, a pale tongue. A red tongue with blood stasis turns reddish purple. In gynecology, the bluish purple is more common. We've got loads of examples here. There. Can we switch those lights off or not? No, it's still not good. Look what the difference it is. Look at that.
There we go.
Is it clear? This is a lady with a myoma.
How old?
With a big myoma. A young woman.
In the uterus?
Yeah. Well, myoma is always in the uterus. Look at that on the sides. No, not at all. That's really blue. It's also swollen, yeah. So that she's got phlegm as well. So she's got phlegm and blood stasis, a bad combination. So you see, the tongue is so fundamental in diagnosis. That this tongue tells you the treatment.
So what's your treatment?
You start from a prescription that invigorates blood, but you must change it to resolve phlegm. What did you say?
Was she treated surgically or just with herbs?
No, when the myoma is big, there's nothing you can do. You can only control the symptoms. If the myoma is small, you can resolve it. By small, I mean less than 3 centimeters, really small. This was huge. That's purple, bluish purple. Also swollen. If you notice that they're nearly all swollen as well. Also there and there. Also in the uterus. This one is good too, look at that. This is a lady with endometriosis. That and that. You see all these ladies with blood stains in the uterus is on the purple color is on the sides, not there. You would expect it there because that's a lower burner, but it's not. And unless that's lipstick, that's purple too. Purple side. This one is interesting because it's bluish purple there in the chest area. We're going to talk about that in a moment.
So could you say that because there's pathology in the uterus, it's reflecting back up through the liver channels into the tongue in the liver area?
Yes, it's reflected in the liver area because the liver is functionally related to the uterus and it stores blood. There's blood stasis in the uterus. I'm not sure why it's not purple there. It should become purple there, but I've never, hardly ever seen a tongue with a purple patch on the root. There is one example of it. This has got three things wrong with it. It's purple, bluish purple. It's swollen, so there's blood stasis, there's phlegm, and on top of that is yin shu. Because the coating is missing there and it's cracked.
What was this person?
I don't remember. Some of these pictures are quite old. This is reddish purple. See that?
But in the center too, it looks purple.
What's that?
That was Lauren's Oh, I said I think I went out with her.
And look at the lips. Look at the lips.
Quite scary.
Very dark purple. Blood stasis. Severe blood stasis. This guy had heart disease. Reddish purple, again swollen, no coating. Blood stasis, phlegm, yin shu. This one is okay on the screen. This is something else that shows a Shen disturbance. That. Swelling and redness. Okay, let's talk about the chest area because that's important in women. The chest area is this one. And I got these three side by side to differentiate them. These are three signs on the sides, but one pertains to the liver, the other to stomach and spleen, and that to what I call to chest area. Notice the difference among these three. This is all along, and rather narrow. This is more in the middle section, rather broad. And this is below the middle section, between the middle section and the tip. And what you look for in that area is a difference in a change in color, a swelling, red points, teeth marks, and lack of coating. A change in color, red points, a swelling, lack of coating, and teeth marks. And that area reflects, I call it chest area, because it reflects lungs, heart, or breast in women. So that's the liver, that's stomach and spleen. Liver, stomach and spleen, chest, chest. That's a good example of chest area, this. In this case, that's purple and without coating.
When you're in practice and if you see that type of a tongue, do you go so far as to suggest to the patient that they have examination?
Yes.
You feel that's strong?
Yes.
Feel it's reliable?
Yes. And so how to distinguish whether it's, when I say lung and heart there, I mean Western lungs and heart, not Chinese lung and heart. So a lung disease like asthma for 25 years or emphysema, then the chest area may be swollen, and in which case you would know it. The patient knows they've had asthma for 25 years. There's not much to discover, to diagnose. Or heart disease, Western heart disease, coronary heart disease, tightness of the chest, angina, etc., etc. Now, in a woman, relatively young woman, in the absence of obvious lung and heart pathologies, that's the breast. Especially when it's unilateral. So I repeat, in a woman, relatively young woman, in the absence of obvious lung and heart pathologies, that area indicates a pathology of the breast, especially when it is unilateral. So this indicates blood stages in the left breast. And it's worse because it's without coating. See, when the tongue is without coating in a little area, is worse, in my opinion, than it is if it is without coating everywhere. It's worse. It's a more suspicious thing, potentially. The fact that it has a very thick coating elsewhere, but it's missing there. That's the left breast. And there's a very interesting phenomenon which I've noticed, is that the tip of the tongue shows the heart, but purely in a Chinese sense, in the sense of Shen. I've never, ever, I don't have a single slide of a patient with a purple tip of the tongue. That's strange, isn't it? Why is that? Because for some reason, blood stasis in the heart itself manifests there. So that's the Chinese heart. This is the Western heart. Shen, Chinese heart, in the sense of Shen. A change here on the tip indicates emotional stress. Red and swollen with red points. But I've never seen it to be pale or purple. Which is interesting because you can compare this finding to the pulse. And that's something I learned from Dr. Shen as well. On the pulse, on the heart pulse, you feel something on the heart pulse. How do you know it's a Shen, emotional stress, or they got heart disease? And Dr. Shen used to say that when you have heart disease, a problem with the coronary arteries, or hypertension, some problem with the valves, it manifests outside, around it. You have to feel around it. Roll your finger in all directions, very, very, very slight. And if you feel something around the heart position, by something, what do I mean? A hardness, a wiriness, a slipperiness, that's probably the heart, the actual heart. But if it feels overflowing in the position itself, that's emotional stress. And it's somewhat similar to what happens on the tongue. Around it is the Western heart. On the tip is the Chinese heart in the sense of Shen. So if I saw a woman, let's say a woman who's about 45, and she has a purple color on the chest area, on the breast area, like that, for example. That's an elderly woman, but like this. Oh, you can't see anything here. Here. I would treat it. Whatever she's coming to me, suppose she may be coming to you for migraine, and she's having a prescription to subdue liver yang, I would add just 2 or 3 herbs, just 2 herbs. I would add Qingpi, because it goes to the breast, move qi in the breast. Mo Yao, which also goes to the breast, to move blood. And Lulu Tong, which also goes to the breast. Tung Ru Luo, Lulu Tong. Tung is the famous tongue we mentioned before. Ru means breast. Luo means luo channel of the breast. So it opens the luo channels of the breast. It's one of the few herbs which is a messenger that goes to the breast. I always add one of these herbs. There's only 4 or 5. Gualuo, yes, also, but it's more for phlegm. Yeah, I'm talking about blood stasis. Yeah, if this woman had phlegm, I would use, if that was blood stasis. If the chest, if the breast area was swollen, I would still have Qingpi. I would have Gualo, and I would still have Lulu Tong, because you need one messenger herbs, which Tung Ru Luo. That's a Chinese slide. That's a man. No, you can't see it very well. That's a man with coronary heart disease. So other things you look for are teeth marks, swelling, and peeling. This is also a good example. This one. Now, when you unplug it, I might have to restart because
The one in the center there?
no. No, unfortunately, I have to restart. Sorry, I have to restart. We better not turn it around anymore. Okay, any questions? And I use that also for prognosis. If a woman comes to you after she's had breast cancer, let's say she's had breast cancer, she had radiotherapy and a lumpectomy, I always look carefully at the breast area. If it's purple, it's a bad sign. If it's not purple, it's a good sign. And if it's purple, then I would actively treat her as if she still had breast cancer. No. 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 Any questions?
What was the base formula you were adding those blood stasis herbs to?
Or any formula.
Theoretical? Oh, any.
Supposing you were treating that woman for migraine. You know what I mean? I was just giving you an example of a woman coming to you for other reasons.
Okay.
Could be migraine, could be B syndrome, anything. I wouldn't, if I see that on the tongue, I would never ignore it. Yes. Yeah. How come it's not coming? I have rebooted.
Oh, you have?
Yeah. Do you think I have to actually switch it off? I restarted it. You think I need to switch it off completely?
The projector?
Oh, the projector?
Yeah, you might want to
Let me shut it down.
unplug it. Is that okay with you?
Yeah, I'm shutting it down anyway. Need to push the button. See, it's interesting, in Western medicine, they measure everything very carefully. We don't measure anything in Chinese medicine. I think we should. measure a bit more. Like, you can have measurements of how much blood stasis you have. They do that in China, actually. According to a score, like 5 points for a purple nose, 5 points for a firm pulse, 10 points for a purple tongue, and you know what I mean? And measure how much blood stasis you have, how much yin shu do you have, how much qi stagnation, how much blood shu. Well, it doesn't exist. That could be a good research for you to do.
Don't they publish some of those findings of the conferences that they established in that?
I think they have done something like that in China for blood stasis. But you could do it for everything. Phlegm. Of course, the nature of Chinese medicine is different than the nature of Western medicine, so the things we do are not subject to the same rigid measurements that they do. But okay. Even if you narrow it down, for example, say you narrow it down to gynaecological blood stasis, that would be relatively easy to do, a score chart of how much blood stasis you have, if you narrow it down to the gynecological field.
I started pondering something like that for a bipolar pilot study. And I come up with 50 symptoms and how bad they are on that score, not by DSM standards, but by TCM standards.
Oh, I don't know why it's not coming. It's strange. Well, the display is the same as before. I'll.
Display control panel.
Yeah, it's this one. This one after 8.
Definitely connected, right?
Yeah, it's definitely connected.
In your control panel, we find the display. If you right-click your desktop.
Holy cow.
This
You gotta cut off on the steroids.
try view.
No, usually you'd have to do this. I'll see. Let's see if it's F6. No, it's this one, F8. It's strange.
Do you mind if I try?
Yeah, sure.
Control panel.
Control panel.
Go to control panel. Let's see. Look for a display.
This is different. This is Vista.
If you go down, I'll try to go down. Projector manager? I don't know what that is.
Projector manager. I've never seen that.
Cancel.
Publishing in Focus Corporation. So it's recognizing the.
I'll try cancel. It might just be a display.
Hang on. In Focus. That's the one I use. That's mine. It's not this one.
Okay, so it's misperceiving it. Go under display.
Display.
Right there. No.
No.
The image.
No.
Status.
Now the only thing I can see is that this is In Focus Corporation is my projector. So it thinks this is the other projector. Yeah, it's definitely in.
There. Oh, there it is.
This?
Yeah.
Ah, great. Sex, that's interesting. What's that? Shall we have a look? I've never seen that. What is it about? This phone is.
You have a quick
Sizes and everything.
That's strange. Strange. Oh, but that wasn't a presentation. It was a folder. You know, when I was in Amsterdam once, I was talking about gynecology, and someone asked me about something to do with male infertility. So I opened up this presentation about male problems, and I was waiting for this, and I was scrolling to this presentation like that, and I wanted to say this is a very long presentation, and I said this is a very long erection.
The male infertility was just cured. That was easy.
Next problem.
Yeah, exactly.
Exactly.
Okay. Okay. So the conclusion was that the Chinese heart, this tip here reflects the Shen, the Chinese heart, and actual heart problems are reflected there in that area. Okay, let's talk about treatment principle. Have you got any questions? Treatment for blood stasis. And blood stasis itself is a biao, because blood stasis is always the result of another pathology, which, as you remember, was qi stagnation, cold, heat, sometimes phlegm. So you need to treat the biao, the blood stasis itself, as well as treating the ben, which may be moving qi, expelling cold, clearing heat, or resolving phlegm. In gynecology, probably the two most common ones that we will use is to move qi or expel cold. And I personally always, if I see blood stasis, I always start by treating blood stasis because I think it's a very important pathogenic factor. It's a very important pathology. It gives rise to serious diseases. So I would concentrate very much on moving blood. You could have used a different approach. Let's say the blood stasis is deriving from Qi and blood deficiency, and just tonify Qi and blood and hope that the blood stasis will get better. But that's not my approach. My approach is always to treat blood stasis with the invigorating blood method. And I use the word invigorating in the same way as Bensky uses it, rather than moving blood, because moving can give you the wrong idea that these herbs literally move blood around the body. And if you've got a little thrombus in an artery, it dislodges the thrombus, it goes to the brain, and you get a stroke. That's not what they do. The Chinese expression is the best. They huo shui. And huo shui, huo means to enliven, to refresh. So they refresh the blood. They change the composition of the blood. If you look at the pharmacology of these herbs, the Western pharmacology of these herbs is very, very interesting. They change the prothrombin time, and they have an immunological function as well. They've got anti-inflammatory functions too. So they don't literally move blood around. They change the character of the blood, the composition of the blood, the pharmacology of the blood. And there is a huge number of herbs that move blood, and they are subject to being categorized in different ways. Different books will have different categories. Of course, the ones that are very important for us are those that are more specific for gynecological blood stasis. And they are these ones. The first two are the most important ones: Yan Hu Suo, Yimu Cao, and Shi Shao as well. In addition to these, there are some herbs that break blood, and they are very important for masses from blood stasis. Here there is the insects, but in addition to that, the two most common herbs which I use all the time to break blood are Erju and Sanleng. And they're usually always used together as a couple. There are famous couples of herbs in Chinese medicine, like Tu Si Zi goes very well with Gou Qi Zi, Dang Wei goes very well with Ba Xiao, etc., etc. And the Ju is usually always put together with Sanleng, and they break blood. I don't tend to use these things. Shuizhe is the leech, and these two are in beetles. Of the herbs, the moving blood herbs that particularly go to the breast are especially three. Mo Yao, the moving blood herbs that go, these are breaking blood. And break blood, you use the method of breaking blood when there are masses from blood stasis. The ones that enter the breast, I use particularly three: Mo Yao, Se Gua Luo, not to be confused with Ga Lou. Segualuo, and Chuanshanjia, the anteater scales. All these three go to the breast. In addition, some of the moving blood herbs that go to the breast are also Tungruoluo. Tungruoluo. Free the breast luo. Segualuo is one of them, and Lulutong is another. And I would use particularly those two. Going back to herbs that break blood, important to remember that even though endometriosis is not a typical abdominal mass, all modern Chinese doctors agree that it should be treated as such, which means that in endometriosis it's not enough to move blood, but you must also break blood, as you do in abdominal masses. And finally, in gynecology, very important ones are those that simultaneously move blood and stop bleeding. And I use particularly the first three, especially Sanqi and Qianzhaogen. Very useful. Have you got this slide? Yeah. This is just an example of the complex pharmacology of the moving blood herbs. The moving blood herbs are the subject of a lot of research done in China. They are very promising herbs in many different fields. And more they are using the moving blood method for many diseases for which they were not before, like diabetes, for example. More and more. And certainly in cancer. And as you look at that, it's a very complex pharmacology, very interesting pharmacology, including an immunological effect, analgesic, and anti-inflammatory. So there are all these, have you got these slides? These are all these methods to move blood. Move blood and move qi, move blood and tonify qi, move blood and nourish blood, etc. Some of which are particularly relevant to gynecology. And nourish blood. The combination of blood sugar and blood stasis is relatively common. Don't think that they are mutually exclusive. And basically, Su Wutang does that, or variations of can do that. Nourish blood and move blood. This is extremely common. I use this a lot. Blood stasis deriving from cold is very common, especially in young women. Young women with painful periods, young women or young girls with painful periods, with blood stasis, that's the first thing I would think of, is cold, invasion of cold. Why is that? Because the uterus is very prone to invasion of cold in puberty time and during each period. And modern women and modern girls do have a lot of life habits which lead to cold in the uterus, not only in cold countries, i.e. improper dressing in cold weather, very cold weather, sitting on damp grass, keeping a wet swimming suit on, playing sports in cold weather like they do in England, with shorts, sweating in freezing weather, etc., etc. All of this aggravated by excessive consumption of cold fluids and liquids. That makes cold invasion of the uterus very common. And the formula I use most of all is Wenjing Tang, which is from the Jinghui Yaolue. It's a great formula, it's a very simple formula, it's very interesting, and it works really well. I use variations of that. And that is very effective for painful periods. I use it in endometriosis and in infertility. The points that move blood, as I said, every point moves blood, but some are famous for moving blood. And that's a very important one, Tai Chung. Whenever you use Tai Chung, you're activating the Chung Mei, sea of blood, with gallbladder 34, spleen 10, and as a local abdominal point for the uterus, kidney 14, stomach 29, liver 14 is not for the uterus. And of course the Chung Mei points, spleen 4 and pericardium 6.
Why does that woman have a penis?
Yeah. And no breasts.
Is that the first time you said that?
That's the first chapter of the Su Wen. Remember, it says the Tiangui arrives, the Ren Mei is open, the Chung Mei is flourishing. It actually doesn't say the Chung Mei. It says the Tai Chung vessel is flourishing. So it actually calling the Chung Mei. Everyone agrees it is the Chung Mei, but it's calling the Chung Mei the liver 3 vessel, which shows the close integration of this point with the Chung Mei. And it shows the gynecological effect of this point is due to its being a Chung Mei point rather than just a liver point. So, have you got this slide with the key messages? The importance of the heart, kidney yin and kidney yang, the importance of blood stasis, going for phases, Chung Mei. And have you got this slide with the differences between men and women? Some of them we have discussed, some we haven't. The first one is very important and very true in practice. Women are far more prone to blood stasis than men in the lower burner. Rebellious chi of the Chung Mei is more common in women, but not exclusively in women. Excessive sexual activity as a cause of disease does not apply to women, for the reason that we saw in the very first diagram we looked at, because the bow in women is the uterus The power in man is the room of sperm, and sperm is a direct manifestation of kidney Jing. The equivalent in women is menstrual blood and ova. And women don't lose menstrual blood or eggs with sexual activity.
Seems to be some area of controversy because not all sources say that.
I know, I've seen that. Some people say that the lubrication, the vaginal lubrication, is kidney Jing. I think it's fluids. I know.
And then it's sort of what your colleague Dr. Xiao was saying about the vaginal mucus or cervical mucus being a manifestation of kidney essence. It seems to conflict with that.
Yeah, but that's not what comes out when the woman is sexually aroused. When the woman is sexually aroused, that fluid comes from the Bartholin glands near the vagina, which are kind of analogous to the Cowper's gland in men. And I would personally classify those as body fluids rather than Jing. I do know that some people say that, yeah. But I think the lubrication of the vagina with sexual arousal is body fluids rather than Jing. It's not the cervical mucus that comes before ovulation. Do you know what I mean?
Yeah, I hear you. It seems like the Taoist tradition also said that.
Said.
That in essence is also released from women during
Is
sexual
it?
activity. But
They say that?
yeah, I believe so.
Yeah, it's a big stream.
Combined men and women, the whole reason behind sexual cultivation. It's interesting. But
Yeah, I also from my clinical experience. Yeah, I mean that's how I see it. That Jing produces sperm in men, and in women Jing produces menstrual blood and ova.
So you see female ejaculate as fluid rather than.
As fluid, yeah. But I may be wrong. Women are certainly more prone to blood shoe. They can get empty heat from blood shoe, which men don't. Also, women more commonly than men get cold symptoms from blood shoe, which, by the way, that's something else that accounts for contradictory hot and cold symptoms. Something else we have not discussed, women often get B syndrome from blood shoe. Some women get like aches and pains everywhere, and it's not really the classical B syndrome from wind, cold, and dampness. It's purely liver blood shoe, not nourishing the sinews. I think it's just generalized aches in most joints of a shoe nature. That's what I call not true. It looks like B syndrome, but not true B syndrome. Liver chest stagnation occurs more often against a background of liver blood shoe, chronic headaches, blah blah, etc., etc. Okay. Any questions so far? These are all the methods to tonify the kidneys. In gynecology, there are basically two ways. One is to strongly tonifying the fire, strengthening the fire. And the other is tonifying qi. The famous Jingui Shenqi is an example of the former. Or Yogui 1 is also an example of it. As I said, in gynecology, I prefer Yogui 1 for a few reasons. One, it nourishes blood as well. Two, it's more balanced between yin and yang. And actually, these are the two main reasons. This is boring. Interestingly, we don't have a category of herbs that nourish kidney essence. But these are the herbs. Have you got this slide? It's interesting. We should have, but we don't. And the herbs that nourish the kidney jing are in different categories. Some tonify qi, some tonify yang, which is interesting. They are more in the yang category than in the others. Some nourish blood, and some are what we call astringent herbs. The ones I would use most to tonify kidney jing would be Tu Si Zi, probably Gou Qi Zi and Huang Jing, and Shanzhu Yu, maybe, those four. Huang Jing, I said, Tu Si Zi, I said Gou Qi Zi, and Shanzhu Yu, which is actually one from each category. Huang Jing, Tu Si Zi, Gou Qi Zi, and Shanzhu Yu. Okay, have you got all these slides, all these things? Okay, let's. Which one?
I think on page 72. Oh, yeah, we have the information. We have the information, we just don't have the...
Yeah, I always take the pictures out when I send the handout,
So we have
so it
it.
reduces the
On
size.
72.
I don't want to start a new subject now, so let's see if there are questions. Or let's talk about sex. Do you think women suffer? Do you think excessive sexuality affects women? And what do women think? It does? You think? Yeah, but that's different. The emotions is different. But does it deplete kidney jing as it does in men? In men is a definite cause of disease, and you do see it in practice.
Would it be like a type of obsession, sort of?
Yeah.
The Japanese teacher teaches that excessive sex for women depletes blood.
Sex,
Women that too much sex suffer from blood deficiency.
blood deficiency.
It says that where women go from blood deficiency to gene deficiency,
Mm-hmm.
men go from gene deficiency to blood deficiency. Too much sex. It's best to have a strong biases that kind of thinking. And that women who do proper breathing techniques do not lose genes.
Mm-hmm.
Certainly been with my personal experience. In fact, it improved my health
Mm.
at a time when my health was very poor.
Mm.
Well, that would be true for men too. I mean, men practicing, theoretically practicing traditional Taoist techniques would, they were used for men and women to cultivate both essence. I mean, so I don't see how that necessarily logically makes a distinction between men and women.
Well, isn't women?
Yeah, because that would apply to men too.
Yeah, exactly.
Yeah, but isn't it true that they control their ejaculation? Right, so they're not actually ejaculating, so that would be kind of not releasing the thing. Women are not
But I mean, for me, it's very physical. Sperm is kidney jing. Where is the corresponding in women? You know what I mean?
That I completely agree with.
Where is the corresponding loss in women?
Right, there isn't. I don't think there is.
The fluids, okay, you may argue that's jing. I say they're fluids.
They come from the same source, so I mean, maybe it's less damaging.
Well, I mean, Tian Gui is menstrual blood, isn't it? And, in my opinion, ova. That's only my opinion. The books don't even say that. Tian Gui is menstrual blood. Women don't lose menstrual blood with sex.
Not unless you're doing it when you're having it.
Of course, which you shouldn't anyway. But normally, under normal conditions, unless you have sex during the period, the women don't lose menstrual blood. Men can lose sperm every day.
I mean, I think if we're arguing what our opinion is interesting, but I think there is a record of that being asserted in even classical Chinese literature. I think the Yizhong Jinjian, which I helped edit, that you're pointing down there because it's there. I believe it's in that particular text. So, I mean, it's not whether it's stated or not. Our discussion is whether we agree with it or not, I suppose, is really, which to me is a different thing than whether it says it or not.
Yeah, but I don't agree with everything that is in the classics.
Sure, yeah, that's...
I don't. I don't. It's, yeah. And even for men, I mean, there has been a change, compared to the Han Dynasty to now. I think our nutrition is far better. And I think that men, excessive sexual activity, it is cause of disease in men, it is. But not as much as it was, in my opinion.
What about the Qigong masters saying if you want to really experience Qigong to have, for men and women to not have sex?
Mm-hmm.
So wouldn't that be on the same subject, that it's like preserving your essence?
Yes.
So that you experience Qigong, how it works.
Then do they say that for women?
By the way, there are two important sexual causes of disease in women. In my opinion, excess sex isn't one of them, but there are two important ones. One is having sex during the period. It's an important cause of disease, which causes blood stasis. And the other, probably even more important, is just too early sex, which damages the Chung and Ren.
Like teenage.
Mm-hmm.
How about exposure to cold?
Well, that's that too, according to Dr. Shen too.
What do you mean by too young? Because
By too young, what do I mean? I mean certainly before puberty, And I also mean, personally, I would say within 2 years of puberty is too young. So if the girl's period starts when she's 12 and a half, I would say within 2 years of that is definitely too young, in my opinion. And that seriously damages Chung and Ren.
We just saw a statistic in one of our classes, wasn't it in one of our classes, that something like 54% of women, of girls are having sex at 15.
Oh yeah, I'm sure it's the same in England. It's the same in England.
But 15 is the same age as they had it like 200 years ago, because that was the time they get married.
That's true. That's very true. Yeah, that's very true. Yeah. Exposure to cold during sex, Dr. Shen also talked about that. Injuring kidney young and the uterus. And Dr. Shen also uniquely also said that a woman shouldn't have sex the day after the period. Just one day after the period. He said it would cause sinking of qi. But he's the only one who says that. But, it's interesting, the ancient Chinese were obsessed with sex as well. And in a very negative way, in my opinion. Very kind of obsessed with it as the danger lurking, robbing your jing, and it's. I don't necessarily. And one thing that strikes me in Taoist books, they told the sexual, which is great. I think the Taoists have some very original, very great ideas on sex, which apply to us. But they never once talk about love. Have you ever Chinese medicine books or Taoist books? They never once talk about love and whether it makes any difference or not. And in my opinion, it makes a huge, huge difference to the Shen.
I'm going to the only Chinese sex museum in China.
Sorry?
In May. There's only one Chinese sex museum in China, in Hangzhou. I'm going. It's right next to the Museum of TCF. It's in Hangzhou.
It's okay. She had to sneak something medical in so she could write it off.
I'm surprised that they have one.
Yeah, it was actually in Shanghai, but there was so much controversy that they pushed it over.
And didn't the government forbid it?
Well, that's why they pushed it further out, because they didn't want so much commotion. So I don't know.
You know that the modern Chinese, what's the word? Modesty about sex, or prudery, what's the English word? Being prudish, is relatively modern. When I say relatively modern, up to the Tang dynasty, which is from 600 to 900, Chinese sexual customs were very free. They were not like now. Were very free. There were sex manuals, and there were songs about sex and poems, and women were quite free. Then it all kind of degenerated from the Sung dynasty onwards, and it got worse and worse through the Ming, and then worse all through the Qing dynasty. This prudishness about sex and the oppression of women is relative. When I say modern, 1,000 modern by Chinese standards, only 1,000 years. Yeah. There is a great book on Chinese sex by Van Gulik. Have you seen that book? Yeah, on ancient Chinese sexual customs.
All the good parts are in Latin.
Yes. Yeah. Yeah.
It's interesting how you describe all the sexual acts and positions are suddenly go into Latin to, I guess, obscure it from certain readers?
No, I think it's a very quaint thing that he did to make sure that his book will be used by scholars rather than people who want quick titillation.
People like me.
People who... But interestingly, I have the English...
I didn't see that.
Yeah, I have the Italian edition, and it's been translated into Italian. The juicy bits are in Italian.
I have it in English. It's out of print.
I can translate the Latin.
Oh, good. I'll bring it.
Back to your capstone.
And it is true what they say about the sex manuals, that married couples had the sex manual under the pillow. It is true. They did. And it was very free, quite free sexual customs. And it's interesting that the modern communists have completely adopted the Confucian sexual repression. Because if you read the proper communist writers, it was all about free love and free sex. And if you read Rosa Luxemburg and Karl Liebknecht, it was all very free. Women were liberated, and free sex, abolition of marriage, and it was a far cry from the communist sexual repression, which is totally Confucian.
So Bob, the text that you used, that she was looking at right now, the translation, is this the one that refers to allowed or suggested release for men by age and by times of the month, or times of the year? Is that the one you're referring to?
No, that's
This is just the
gynecology
section.
of the...
I did find 2 references to adverse effects for women having sex. One effect on the women and one effect on the fetus. Menstrual block is often the result in women who engage in excessive sexual activity which damages yin blood. And then the fetus one is...
You mean having sex during pregnancy would affect the fetus?
The first one doesn't. The second one, it is talking about sex during pregnancy.
Yeah, I mean, that's very common. All Chinese all doctors say that. Most of them say not to have sex during pregnancy.
If sexual taxation damages the kidney, the chi of the fetus will not be secure, which easily results in a disquieted fetus.
Yeah.
So in sexual taxation, it's not really saying sex during pregnancy. Is that you be taxated before you become pregnant?
Before you become pregnant? I don't know.
Those are there might be a third reference, but those are the only 2 that I could.
Okay, let's finish here, and I'll see you tomorrow. We start at 8.